What are the misconceptions out there about veneers that you hear that maybe drive you crazy? It's just not true.
I think one of the biggest misconceptions is they're not going to look natural. They're going to look too long, too bulky.
You're saying that's the hands
artificial.
of the dentist.
That's the hands of the dentist.
You have to have an eye for this.
You
I
do.
guess like anything else.
Yeah, you do.
So when I see somebody walking with these big veneers, you're saying that's just poor design.
That's actually what sometimes keeps people from having this done. They don't know it can be done well. And usually it's the gorgeous smiles that you see out there that you think are natural are actually done by a skilled dentist.
A lot of Hollywood doing this, by the way.
Yeah.
You know, another fear that, or another misconception that comes along is that, are you going to whittle my teeth all the way down to little nubs before you do this?
Okay, well, that's a good question.
That's another,
great,
that's another thing that goes wrong with the skill of the doctor, is knowing what to do, how to do it.
So it's safe, I mean, for the most part.
It is.
Yes.
No study saying it's going to cause early tooth loss or anything like
If
that.
it's done correctly, no. Let me show you some photos.
All
We
right.
brought some, these are going to blow you away.
All right.
This is a picture of Elsa. She came to our office. She didn't like her smile. Look at that gap right in the middle of her teeth right there. That bothered her. In fact, the funny thing about Elsa, I'll always remember this. She told me that her grandkids teased her about her smile, about the color of her teeth.
Is that right?
Absolutely.
Okay.
And I think that's one of the motivating factors, believe it or not, that got her in here. She wanted her teeth fixed her whole life. She really didn't know what could be done or who to ask. And when she showed up in our office, she felt comfortable. She saw what we could do. And she was
So
ready
what
to go
were
for
her
it.
options? I mean, when you look
Well,
at that smile, what are you saying? Okay, she needs what?
Yeah, actually, believe it or not, her situation is typical of somebody at her age. She has a gap between her teeth. Her teeth kind of have that worn look. She didn't like the size of her teeth, and she didn't like the color. It had been fixed several times before. In fact, on her two front teeth, you can see where her teeth had been fixed and had kind of aged and stained a little bit and cracked over time. She just wanted something done, and so we gave her options. And her options really were either to whiten her teeth, but that wasn't going to work.
Okay.
Because her teeth were stained, they were misshapen anyway, and they were stained really beyond what whitening could accomplish. Her other option was just to fix the gap. We were worried about that making her two teeth be too big, or two front teeth be too big, so we talked to her about doing her complete smile. So look at her after picture. I mean, we no longer have to force her to smile. When we were taking her picture, her before picture, we had to encourage her to smile, we had to tell her a joke, we had to really pose her to smile to show us her teeth. Her after picture, it's automatic. She looks gorgeous.
So put these side by side, Randy. What do you notice?
Well, she looks younger, a lot younger in the after. Also, there's almost a level of sophistication. She almost seems smarter in the after.
Yeah, look at her eyes. I mean, they seem to sparkle. She seems to enjoy what she's doing. And
so what does she say, by the way, that woman?
We've seen her come in the office a number of times now that she's had her smile done, and I mean, she's a total different person. She comes in with enthusiasm.
she says, why didn't I do this
energized.
20 years ago?
Is that right?
Yeah.